So just to set the stage, upper tract urothelial carcinoma is very similar as bladder urothelial carcinoma in that the staging is dependent on how far the disease invades into the layers of the urothelium and the underneath layers. Now the difference is, in order to access the upper tract urothelial carcinoma, you have to use very tiny instruments that are 3 to 4 millimeters in diameter. And using such instruments, it's impossible for us to really understand the depth of the invasion. And so oftentimes in the clinical setting, we rely on nomograms that take into account a lot of the clinical variables associated with the disease. But suffice it to say that these nomograms are far from sufficient in staging the disease in the patient prior to surgery. And the problem there is we know that neoadjuvant chemotherapy, cisplatin-based chemotherapy specifically, has demonstrated benefit in that population, either given in the neoadjuvant setting or in the adjuvant setting. Now the problem is, for a lot of these patients who undergo a radical nephroureterectomy, inherently they're losing kidney function, making it impossible for them to receive adjuvant cisplatin-based chemotherapy. And so it's very important for us to properly stage these patients as best as we can prior to the onset of their surgical extirpation. And so we set out to test the hypothesis whether or not a plasma ctDNA that's obtained prior to surgery can help us understand the staging of the disease. And we took plasma samples from 30 patients and ran a panel genomic test on the circulating cell-free DNA and detected that there was higher prevalence of ctDNA in the muscle-invasive or non-organ confined UTUC patients as compared to the non-muscle invasive, as you would expect. Moreover, we also found that detection of ctDNA prior to surgery also has important prognostic implications, such that after surgery, just from the preoperative information that we've gathered, you can foretell whether or not the patient's going to develop recurrence and even death from UTUC. So it is a very small cohort for a proof of concept and needs to be validated in bigger studies, but I believe this is a very positive step in the right direction in helping to tailor the therapy according to the patient's true risk factors.